All right, thank you, everybody. We want to be sensitive to everybody's time and would like to get started. All right, thank you very much. My name is Cameron Smythe, Cameron Smyth, and I am proud to serve as the mayor here in the city of Santa Clarita. We have a number of speakers that will address and come to the podium throughout the conference, but I do want to acknowledge that we've got our LA County Supervisor, Catherine Barger, here. We want to thank our Chief of Police, Captain Lewis, and all of our partners in law enforcement for allowing us to use their facility. Also with me is two of our city council members, Bob Keller and Councilmember Marcia McLean as well. We have representatives from our local treatment facilities, other city officials, our local hospital, and school district officials. You know, it's been said that, and it's true, that the issue of heroin is a nationwide problem and not one unique to Santa Clarita. And I think we have seen that at the federal level in particular, when the discussions have gone on about healthcare and the use of opioids and opioid addiction being a key part, and treatment of that being a key part of any future healthcare program. And Santa Clarita is a community that isn't immune to the issue of heroin addiction. But what makes us unique is the way that we're going to tackle this issue and continue to do it. This is a community-wide issue that affects all demographics, socially, economically, regionally, and the sooner that is acknowledged, the sooner we're able to put the resources on the ground to tackle this issue, both from a law enforcement and a treatment program. This is a holistic approach that the city and the county and our school districts and our healthcare professionals all agree is the best approach to do that. And so what I want to do is introduce some of the folks that are on the front lines and are going to provide some of those services and treatment and provide you some information on how we are in Santa Clarita taking this issue and taking that holistic approach and putting into practice. And so first, I'd like to bring up our LA County Supervisor from the 5th District, Catherine Barger.
Thank you. I want to thank you. It's a pleasure to be here today. It's no secret that opiate abuse is prevalent not only in LA County, but across this nation. Every day you will hear a story about what is going on. The state of Ohio alone has declared this an epidemic of mass proportions. On the average, 91 people die each day from an overdose. Unfortunately, our county is not immune. And of course, we've seen its devastating effects on families and communities throughout our region. In addition, too many health providers, medical professions, organizations, schools, and churches are there helping to try to help the community rebuild and give parents and individuals options as it relates to getting treated. In Los Angeles County, we do care. We believe that those who struggle with abuse can and need to receive the help they deserve. Fighting the problem requires a broad approach, which involves collaboration with county agencies, city government, and our community partners. And I emphasize our community partners because government cannot do this alone. It is about getting out there and working with our faith-based organizations, with those that provide support to help those in need. As a result of my motion that was brought in yesterday and approved unanimously by the board, our county CEO is developing a comprehensive strategy to addressing the issues facing us today as it relates to opiate abuse. It's not just about treatment, it's about education. Today, we are here to announce the step forward in this effort. Our first responders in law enforcement are often the first to arrive on a scene at a medical emergency like an overdose, but until now have not been equipped with the means to immediately respond to the overdose. These deputies based in our Santa Clarita Valley station will now have a vital tool to help victims survive and have another chance at life. And I want to commend our leaders up here in Santa Clarita for letting this be the first of what I'm hoping is countywide use of Narcan to address this issue. I'd like to acknowledge the efforts of our commander, Judy Gephardt, whose 23-year-old nephew died in December of an overdose. And I want to thank her for being courageous enough to step out in front and put a face with what is going on in this community. 23-year-old, his life cut short. With her daughter, Michelle Payne, who also works for the Sheriff's Department, she began researching overdose remedies and helped craft a pilot program supported by Sheriff Jim McDonald, who I want to also commend for being the first in the county to step forward and move forward with Narcan. We appreciate your efforts, and that's why we are here today. There's a critical window of opportunity when someone who suffers from substance abuse reaches out for help. Working with the sheriff and fire departments and the health agency in the County of Los Angeles, my motion will examine ways to establish safe locations where someone can go for help and interface with healthcare professionals, increasing the likelihood of success in addressing addiction. We're not here to judge, we're here to help. Last, we want to continue to reach out to the public, especially young people, about the consequences of opiate abuse. I want to thank everybody here who's working toward this effort to conquer this battle. I want to let you know that you can conquer addiction now, and we can offer you the help. I encourage you to get out the word and let people know that we are here to help and make a difference. Thank you.
Thank you, Supervisor, and certainly thank you for your leadership and the county's involvement to help us continue to tackle this issue. Both Supervisor and I had mentioned in our comments about the front lines, and our healthcare professionals and our law enforcement very much are usually the first to see and to treat those with an overdose. And we certainly have that here in Santa Clarita at our Henry Mayo emergency room. And so I'd like to bring up one of our doctors who's been on the forefront of the treatment of this issue, and that's Dr. Darren Privet.
Good afternoon. Grateful to be here today. We're at a great opportunity that we have to collaborate, unite with the Sheriff's Department, with the city, and also with the hospital here in the Santa Clarita Valley. We all know the dangers that drugs can have on a community and on an individual, and this is a great opportunity that we have to recognize the problem and also to address it. And more importantly, that we can provide this antidote for those people who may be overdosing and are suffering serious consequences from the drug, to provide that antidote for them to help them overcome that overdose and potentially life-threatening emergency. So thanks for being here.
Thank you, Doctor. Also, then, what is the next step, right? If we get people through those critical times, obviously we want to transition into treatment. And again, whether it be through a faith-based or nonprofit-based program, treatment certainly is the next step and is certainly more preferable than incarceration. And one of our community leaders on the treatment side is Carrie Quashen. I'd like Carrie to come up and say a few words as well. Thanks.
Wow, first I want to say how excited I am to be here and how excited I am of this. I've been on the forefront of fighting drug addiction now for 35 years, and for the last 10, I've been screaming that we're having an epidemic with opiates, and it's going to get worse than the 70s, and people are going to die. And guess what? We're there. It's worse than the 70s. We're having an epidemic, and people are dying. But what Catherine's and the Sheriff's Department and everyone is doing is what I call saving lives. I was just looking at this text message, and I know I'm really short on time, but I have to read this to you guys. I got a phone call from this girl. I'm not doing good at all, just trying to hold on to myself. Then I said, what's going on? She said, okay, I overdosed the other day. I was dead for almost 2 minutes. They said they didn't think I was going to make it. I'm lucky. We put her in treatment 2 days ago. Narcan and the programs that Catherine and the Sheriff's Department is putting together is going to save lives. And right now, in the midst of this epidemic, we have to think out of the box. It's not about anything else but thinking out of the box, doing what we got to do to save lives. And I commend the Sheriff's Department for what they're doing. And hey, by the way, it starts when they're young. Education's everything. We are never going to take drugs away. We need to educate. We need to keep our children hardwired, and we can surely make a difference. So thank you for being here today. Carrie, C-A-R-Y, last name Q-U-A-S-H-E-N, with Action Family Counseling Drug Treatment Centers. Thank you.
Thank you, Carrie, and we certainly recognize the work that you're doing in our community as well. And then our last speaker is our local Chief of Police, Captain Robert Lewis, and obviously our law enforcement community is one of the largest, if not the largest, piece of this puzzle and part of our holistic approach into tackling this, because obviously, along with being some of the first responders to overdose issues, we certainly rely on our law enforcement to get those who are selling this devastating drug and to get them off the streets as well. And so I'd like to bring up Captain Lewis to say a few words as well.
Thank you, Mayor Smythe. Good morning, everyone. Thank you for being here. I want to thank everyone who's standing behind me and all of you for being here. As you can see, it's a united front from the Santa Clarita Valley regarding the opioid overdose epidemic that's hitting our country and in portions of our city and county area. I want to thank all of you for coming here today because as Sheriff McDonald stated a few weeks ago, the story that you report from what we're doing here today can really save a life. And that's what we're here about today, is to save lives, and as many lives as we can. This message goes out to parents, families, schools, places of worship, and public institutions to be on the lookout for signs, symptoms on the latest health epidemic, which I believe is something that we are trying to tag as a law enforcement agency. But today I'm specifically talking about opioid overdose deaths and overdoses attributed to heroin and illegal and legally prescribed drugs. With the growing wave of addiction to legally and illegally obtained opioids, such as heroin, various prescription medications, Santa Clarita Valley recognized the vital importance we needed to play in the role against trying to do enforcement. When I arrived as the unit commander back in April, I saw that there was an increase in overdoses in the city of Santa Clarita, and in late April 2017, after an alarming number of opioid overdose emergencies reported by Henry Merrill Hospital and Dr. Privet occurring within a 72-hour period, those potential overdoses were a signal to me as the police chief here and the captain for the station. We formed a team focused directly on locating and arresting local illegal narcotics dealers. The team got to work immediately and focused on rooting out the source of devastation and making the areas they serve a safer and healthier place. Our diligence and perseverance saw immediate results with the arrest of 6 suspects within a week and the location of approximately 14 ounces, just over a pound of heroin, which were targeted for the streets of Santa Clarita, including $10,000 in U.S. currency and 2 cars which had hidden compartments concealing the narcotics. One package of heroin was laced with fentanyl, which we had tested, and it's a powerful opioid administered in surgical settings by medical professionals for the purpose of sedation. To date, I can tell you that over the course of the past 7 weeks, with the small team that I've had out there, we've had 39 arrests of narcotic dealers and have made or seized well over 2.5 pounds of heroin. I'm going to tell you that from Santa Clarita Valley Sheriff Station, we have a 3-prong approach. We have our intervention, our education programs, as well as our enforcement. And our enforcement has been tremendous over the course of the past several weeks. One of the individuals that belongs to my juvenile intervention team that deals with the intervention portion from our aspect of the educational portion is Deputy Bill Velick. I'd like to have him come up and say a few words about the intervention and education portion that he provides. And I really want to get that out to the community because he is a great resource for not only our community, but for other communities that are experiencing the same issues. Bill Velick, if you come up.
Thank you, Captain. My name is Detective Bill Velick. I work on the juvenile intervention team here at Santa Clarita, and two of my primary focuses is community education on the drugs that are facing our community, and intervention, helping families and drug addicts find help through the resources that we have in our community with programs like Carrie's Action Program or Bob Sharst over here with the Way Out. Families often call. The schools will call me. Sometimes the school resource officers will call me and say this family's having difficulties, and we'll help them find resources that are out there, whether it's a local resource or if we have to find them resources out of the city or out of the county or out of the state to match what that family's needs are. My partner, Bob Walksmith, is our intervention specialist that's attached to the team from the city. He helps us out, and I think that's it. Okay. If anybody needs any community groups that are looking for education, they call the station. Myself and other members of the team will come out and do parent education with any kind of group, PTAs, different service organizations throughout the community. We'll bring out all our paraphernalia, let the families know what it is to look for, what the signs are, so that they can help determine on their own if there's a drug use problem going on in their house before it becomes a huge problem. Thank you, sir.
So on the enforcement standpoint, I want to say this to all of you. I want to send a message to those that are providing drugs and illegal narcotics to the residents here in the city of Santa Clarita. No more. We're not going to put up with it. We're here to provide the enforcement against it, and we'll be out there looking for them. I want to bring up Supervisor Barger again. She has been supportive of the Narcan, which we are going to be distributing here at Santa Clarita. We are one of the first stations to receive it, and I wanted her to introduce Commander Gerhardt.
Thank you very much. And I just have to say one thing on the side. I think everybody here can tell a story. I know of at least 2 people that have passed away as a result of an overdose. It doesn't have any knowledge of socioeconomic status. It happens in every community, and up here is no different. And so I hope the community groups will take up the offer by the Santa Clarita Sheriff Station to educate the parents and educate the kids. So with that, I want to bring up Commander Judy Gerhardt, who I mentioned in my remarks. This is a woman that is so courageous. It's affected her life in ways that none of us can imagine. And rather than hide, she's stepped up and said, we need to do something about it. And so I have to give this to you, Judy, for just everything you're doing. And I know you are going to save lives as a result of what you're doing. So here you go. And then I have one more for her beautiful daughter, Michelle, whose cousin, Judy's nephew, her cousin. And Michelle, thank you for working with your mom to make a difference. And now I'd like Judy to say a few words.
Thank you so much for being here and for sharing our message. My personal story about my nephew was the catalyst for these efforts for me personally, but this effort really isn't about him. Maxwell, we called him Mackie, was just one of 50,000 people that lost their lives last year because of an opioid overdose. Our efforts are designed to impact the lives of those people who are suffering with addiction. Those are those people who are still living, who still have a chance. We want to let them know that there's hope. We want to let them know that treatment's available and that they can recover. They can go on to live productive lives. We want to support the friends and family of people who are struggling with addiction because the illness really affects everybody. As a family member, I know that it's very difficult. Sometimes admission is hard, but we want friends and families of people who are struggling with addiction to know they're not alone and there are support systems out there to offer help. We need to remove the stigma that's associated with addiction and start talking to each other about it openly and honestly so that people who are facing addiction come out of the shadows and feel safe so they can seek recovery. On the professional side, I applaud the enforcement efforts from Santa Clarita Station. There's definitely a role for law enforcement in this epidemic. We want to continue to aggressively pursue those who manufacture, distribute, or sell illicit drugs in our community, because really they're taking advantage of the vulnerabilities of those people who are struggling with this illness of addiction. So I'm here with the supervisor to sound an alarm, an early warning system, if you will. The opioid epidemic is devastating communities across this country, and we don't want to see that happen in LA County. We have an opportunity and a responsibility to get in front of this problem. So I applaud the supervisor, Captain Lewis, and the city of Santa Clarita for their commitment to this issue, and I think they are really setting the example for the rest of the communities to follow. Thank you very much.
Thank you. Well, again, thank you for first for turning out, and for certainly all of our speakers. As you can tell, this is an issue that we take very seriously here in Santa Clarita. And what I love about this community is that when there is an issue, when there is a problem, we don't run from it. We acknowledge that there's a problem, and then we decide that we're going to fix it. And then the question is, how do we fix it? And we know in Santa Clarita you do that by bringing everybody together, between the county, the city, our law enforcement, our school districts, our healthcare professionals, our treatment professionals. That's how you solve this issue. And that's one that we are going to continue to tackle until we don't have to tackle it anymore. And that may be a little pie in the sky, but I have faith in this community, and I have faith in the people that are here that are going to do everything they can to reduce this issue and put as many people back into productive lives as possible. Put those in jail who need to be incarcerated. We'll do that as well. But we certainly want to tackle this as an issue specific to Santa Clarita. Just a few other things. Since 2011, the city has continually had the Heroin Kills initiative that continually highlights the dangers of drug use. And this award-winning program has been instrumental in reducing the number of heroin-related deaths in Santa Clarita. The Defy and SCV initiative heightens awareness by our youth by bringing programs and workshops into our high schools, middle schools, and now even our elementary schools, which is, it's hard to think about that as I have kids in elementary school, but that's where we are. And we have to tackle that and start that education program as soon as possible. The city will be hosting our annual Parent Resource Symposium on Wednesday, September 13th. Over the years, it's had various names, but again, it will always highlight and be a hard-hitting awareness program for parents, teens, and other community members about the dangers that we face. We have, again, partnerships between that we've talked about earlier. Will continue to be a part of the program. And again, if there are resources available, if people want to report an anonymous crime through LA Crime Stoppers Network, which is online or by phone at 1-800-222-8477. And again, working together as a community, that's how we're going to tackle this issue. So with that, I'd be happy to take any questions for any of our panelists at this point. So again, I think the question was, why here? I think we all mentioned earlier, it's not unique to Santa Clarita, but this is unique is how we're going to tackle it. And so I think, like we said, this issue hits all economics, all demographics, all education levels, and so what we want to do is tackle that. I don't know if Captain or anyone has any other, but I think this is, again, this is not unique to Santa Clarita, and we're going to continue to tackle that. Sure, Carrie, please.
Just a quick comment on that. People are asking me all the time, why are we in this crisis? I want everybody to think for a second. In most homes, we spend between 2 and 10 minutes with our children. Think about it. How was your day? It was good. How was school? It was okay. Do you have any homework? I done it. Are you hungry? I ate. That's the conversation we're having with our children. What is the last thing a 14-year-old kid does before they go to sleep? Anybody know? Get on their phone. Say good night to their friends on social media. First thing they do when they wake up, what is it? Say good morning to their friends. Then they have us parents for about a minute. They go to school with the friends for, 8 hours? Back home, what are they doing? With their friends again. You want to know why we're in a crisis? Think about it. We have to pay attention to our children. We have to be there. We're never going to take drugs away, but we can sure educate, re-hardwire our kids, and make a difference. Thank you.
Can you talk about the deputies with Narcan? Have they actually received the treatment already? How much training have they gotten in the last couple of weeks? So, right, so the question is about the Narcan and how much have the deputies received training programs? Have they used it?
I'm happy to talk about the Narcan program. It's something that we're very proud of. We've been researching it for several months. We deployed about 1,200 doses of Narcan last week. The deputies are going through the training because it is a medication. There's first aid training protocols that they need to go through. So they're going through that training. They'll be equipped with 2 doses of Narcan, 2 single doses out in the field. That came out of the sheriff's budget, the first 1,300 doses. However, I'm happy to say that we've also partnered with the Department of Public Health, and we're the recipients of an additional 5,000 doses that's going to be deployed in the rest of the county, hopefully in the next month. So we are moving forward with Narcan. It's really almost like a miracle drug. It reverses the opioid overdose. However, I want to stress that, deploying Narcan is immediate intervention, but it's certainly not a solution to the problem. So it's a first step, and it's a big step, and we're very proud of that, but there's so much more to do. As the mayor commented, we really want to take a holistic approach to this problem. But we are happy to say that the Sheriff's Department is going to be deploying Narcan countywide in the next few months.
How many deputies specifically at this station have Narcan?
Captain Lewis?
We'll be deploying. At this station alone, we have approximately 240 sworn personnel assigned. That's between sergeants and deputies. The Narcan is going to be deployed, trained to all levels of sworn personnel, deputies, and sergeants to be provided in supervisors' vehicles as well. So that's it.
Somebody who's never doesn't know about Narcan or what it is, just explain exactly how quickly an overdose.
Okay, so Narcan or naloxone is an opioid antagonist. And what that essentially means that when you take opioids, it binds to that specific opioid receptor in the brain. Narcan is an antagonist, and it has a higher affinity to that opioid receptor. And so it competitively competes with the opioid and blocks the receptor, and therefore making that opioid ineffective, and inhibits that opioid to cause any type of further consequences from that drug. Now the key, even though that Narcan is the powerful antidote to reverse the effects of the opioid, I think the most important thing you have to understand is that when you find an unconscious person and you determine that they might be unconscious because of narcotics, the first and most important thing that you need to do is try to provide some type of oxygenation. We have to give them oxygen. So even though Narcan is a powerful antidote, it's not the end result that's going to actually allow this person to be saved. It's the first step, and it needs to be administered immediately as possible. But we need to activate 911 right away. So we need to give the Narcan and 911 simultaneously so that the first responders can get on scene to provide oxygen. And if there's any further dosages of the medication that they can give continuously, then that's what we'll do. But the key is to give it early, but more importantly, to make sure that we provide some type of oxygenation, whether we do that through CPR or more importantly, to initiate 911.
Thank you. Yes, sir.
Thank you guys very much for putting this together. It's very much needed. How open is the city and the Sheriff's Department to collaborating with other treatment providers in the community that might have a different approach on how to treat the issues of addiction and mental health?
Yeah, no, and I think that's a good point. That with a lot of addiction, I think anecdotally comes with a mental health component as well as part of the treatment. So I think from the city's perspective, we're at the level that obviously you have to go through some some demonstration of commitment and viability. But I think the city's open to any type of treatments. Again, whether it's your kind of your traditional nonprofits, or you've got faith-based or others. I think we're very much open and receptive to that, and I would think that the sheriffs in all county as well.
Yeah, I'll talk for the county, and I want to make it clear, it is no one size fits all. And the county, our goal is not just this program, Narcan, is only one step. And when I talk about you can conquer addiction now, and we're here to help, it's going to include the mental health component, because many are self-medicating, many are in need of treatment beyond just the alcohol and drug treatment. So the county is coordinating, and we have contracts with private providers throughout the county to address this issue. So we are looking at, as the mayor said, a holistic approach to this, and it is not a one-size-fits-all.
Absolutely. Sure, come on. Just introduce yourself.
All right, my name's Bob Sheritz. I'm with the Way Out Recovery, a local treatment provider. And in regards to that question right there, we are making a really big effort with the city and with the sheriff's department and other treatment providers to bring everyone together so that all the treatment providers in the city of Santa Clarita can collaborate with sheriff's department, with the county, and with the city, because it is not a one-size-fits-all. And we want to collaborate as treatment providers, all as one, and bring everybody together so that we can address this problem head on, and so that anybody who comes through the sheriff's department, the city, or the county, or anybody else, hospital, can be directed to any of the treatment providers, and we collaborate with each other and place them where they're best suited. So, thank you.
Thank you, Bob. All right. Again, thank you all for coming. I know the speakers are available for one-on-ones if you need to. But again, thank you all for coming. Since you are here in Santa Clarita, we do have another press conference in about, right, to talk about 4th of July and fireworks safety and the importance of that. Obviously, with the fires that we've just seen this week, it kind of reinforces the importance of fireworks safety as well. And that will be at the fire station just down the street on Citrus. So with that, thank you all very much for coming. Again, I encourage you to look at the displays. Feel free to grab any of the speakers as well. But thank you all very much for coming.